My name is Mikko Kiiskila. I'm the CEO and co-founder of Medoc. Really happy to be here in Sweden amongst all of you experts. I'm going to talk briefly about a better way to see a doctor. Now, we all know that going to a doctor on a Friday evening, if you're sick, you have an eye infection, you really don't want to go to the clinic on a Friday evening if you're doing something way better. There has to be a better way. Quickly, who we are. That's me over there. I'm the CEO, co-founder. In the middle, Dr. Ville Komulainen, our medical genius behind the service, and our CTO, Juho, on the right. His team can build anything. We're based out of Berlin, thanks to our excellent investor, Excel Health. And it's a perfect position to focus on changing the European telemedicine landscape. Now, the problem we are solving is that every day there's 175 million health-related search queries per day in Google. In fact, it's the second most Googled category online. And actually, 93% of all patients would want to see a doctor online. And as a matter of fact, 75% can be treated by telemedicine of all primary care visits. So, what has changed? Since iPhone 4S, actually the processing powers have increased so much and the cost of technology has gone down and the pressure for increasing expenditure needs ways to curb the costs, as we all know. I'm introducing here now Medoc, a better way. What it is, it's basically a super simple solution for you. It's a chat. It's an app with a chat on it. You can start chatting, type a message to a doctor, and it pings all of our doctors. And the first doctor on their phone, on their pocket, pings you and claims you as a patient and start chatting with you. You start chatting with the doctor within minutes, and they can diagnose you. You can send a picture message, like show what's going on in your arm. If the doctor feels like you need to initiate a video call, they make a video call with you. And that's basically it. Then you can get prescriptions sent to your nearest pharmacy. Really simple. And in order to make something like this super happen, like when we started 2.5 years ago, it took us to become a CE-certified medical device, HIPAA compliant stateside, FDA Class 1 compliant, payment processor for credit cards, certified electronic medical record provider, a whole ton of regulations and complexity to make such a simple thing happen. It really is that simple. You go to the App Store, you download the app, and get rid of it right now. So why is it better? It's better in every way. First of all, for you as a patient, you can skip the line. You don't need to go and wait at the clinic and see other sick people out there, and you can start replacing 2 hours of your life with a few minutes of chatting. That is actually clocked average. When we still were doing video call first, average duration of our video calls was between 3 and 7 minutes. Something happened when you compare to a physical world where it's 20 minutes to a typical doctor's appointment in Finland, our first pilot market back then. Something happened in the experience that you just went straight to the matter, and you got your problem solved faster, and you were super happy. So then for the doctor, okay, yes. If you look at the throughput per hour for patients coming in to your office, if you have 15-minute slots or 20-minute slots, that's 3 to 4 patients per hour. But because the time it takes to treat a patient with Medoc, you can treat a lot more patients per hour, and you can treat them actually anywhere. So it's a nice complementary income generator for you as a doctor. You can literally be on the gym or checking out how your investments are going up and still treat patients. Most importantly, for the payers, you save money. So that is the fundamental fact that it's happening in 2 ways. If you look at the unit economics, we've been able to reduce the price per consultation down to 30 to 50% easily. So the unit economics is way cheaper to get a problem solved. And then also increasing the adherence and compliancy for long-term patients reduces this cost. This is actually a case study what we conducted for real with one of our customers. So, and that is just a conservative number from them. It can be a lot more. So how's it different? There's other solutions also. we actually like focusing on chat first. We've seen solutions that are video call, and what happens with video call is that like you need to go to a secure place and find out like for time to speak with the doctor. But with chat, it's that you can really literally be right now in the audience and like start chatting with the doctor. Or if you're a doctor, you can also be like anywhere actually treating patients in your physical clinic. You see a push notification in between patients, you can start treating the patient. So it's a lot more discreet, you can do it anytime, anywhere, and thanks to this truly mobile end-to-end solution, we have a 24/7 service, and the doctors and patients are both loving it. 2 figures I'd like to share. First, we have a really high patient satisfaction rate. 98% of our patients are really like, yes, this is great. And they use it again and again, and they recommend it to others. So really happy about being able to provide such a great service. And another figure is that with our customers, we have coverage now currently of 4.7 million people being able to have access to it. Okay, recent example how the story has gone on. We started recently cooperating with the insurance company If, and they are using this as a part of their pregnancy insurance product with the help of a chat with the midwife and a nurse, and Apple Health Kit connected a wireless blood pressure monitor, and that's how we can detect pre-eclampsia and have nervous expecting moms calm down and have them going earlier to the clinic if necessary. Interesting just example. So we are also now connected to the physical wearable devices. You can send your data to a doctor. If you're into quantified self, you can see what to make out of that data. Okay, we're live in Europe for consumers, thanks to EU regulations. It's English-speaking service. And thanks to the European regulations, you can get your prescription to your nearest pharmacy anywhere in Europe. As long as you're in Europe, you don't need to be European, you just need to be in Europe. Technically EETA. And it's just 34 euros. Not a lot of money for the convenience. And actually, we are working together with the insurance company If to making the service happen in Sweden as well. So we're gonna speak Swedish still during this year with Swedish doctors. We've recruited first doctors in Sweden, and we're gonna bring the service here as well. We're really happy about being able to bring the service here as well. That's it. We're looking for partners. Thank you.
Thank you, Mikko. Excellent. Full speed. Very good. Have a seat. We'll get back to you in a bit.